In this video, I'm going to explain everything you need to know about sildenafil, also known as Viagra, especially how it works in the body and about specific side effects. I'm also going to answer some frequently asked questions in my clinics. How do I take Viagra for the best results? Or why is my medication not working? Can women take Viagra? And can it help with Alzheimer's disease? And is it true I can buy this without a prescription? These are really important questions that you should be fully informed about when making a decision about taking any medication. And this video will help you to understand more about sildenafil and allow you to make a logical decision about taking it. So let's get started. What is sildenafil? Sildenafil belongs to a group of medicines called phosphodiesterase 5 inhibitors. Sildenafil is its generic name or chemical name, and Viagra is its brand name. It works if you have erection problems, or called erectile dysfunction, by temporarily increasing blood flow to your penis when you get sexually excited. It also is given for a condition called pulmonary hypertension, and this works by relaxing blood vessels in your chest. This increases the blood supply to your lungs and reduces the workload of your heart. So what is erectile dysfunction? This is when you are either unable to get an erection or you're unable to keep an erection for long enough to have sex. Depending on the cause, you may still be able to get an erection at other times, such as when you wake up. Sometimes you might also have low sex drive, or called loss of libido. So what are the causes of erectile dysfunction? Now, most men occasionally fail to get or keep an erection, and this is usually caused by stress, tiredness, or drinking too much alcohol. It can also be a side effect of some medicines. If erectile dysfunction happens often, it may be caused by a condition such as high blood pressure or high cholesterol, by diabetes, or depression or anxiety, or hormone problems. So what is the correct dose for the best results? Sildenafil tablets for erectile dysfunction come in different strengths, ranging from 25 mg to 100 mg. The usual dose is 50 mg when you need it, and don't take this more than once a day. The dose can be increased to 100 mg or decreased to 25 mg, depending on its effect. It usually takes about 30 to 60 minutes for sildenafil to work for erectile dysfunction, and you can take it up to 4 hours before you want to have sex. Taking sildenafil alone will not cause an erection, so you need to be sexually excited for it to work. So how do you take it? Swallow the tablets whole with a drink of water or juice, but make sure it's not grapefruit juice. For erectile dysfunction, it's best to take sildenafil on an empty stomach. It may take longer to work if you take it with food. So can I drink alcohol? Yes, you can drink alcohol while taking sildenafil, but drinking lots of alcohol can make it difficult to get an erection. To get the most benefit from sildenafil, if you're taking it for erection problems, don't drink too much alcohol before taking it. Now, is there anyone who should not take it? If you have ever had an allergic reaction to sildenafil or any other medicine, if you are taking medicines called nitrates for chest pain, if you have a serious heart or liver problem, if you've recently had a stroke, heart attack, or a heart problem, if you have low blood pressure, if you have a rare inherited eye disease, if you have sickle cell anemia, if you have leukemia or multiple myeloma, if you have a deformity of your penis or Peyronie's disease, if you have a stomach ulcer, or if you have a bleeding problem like haemophilia. So what are the common side effects? Headaches, feeling sick, flushing or called flashes or hot flushes or flashes, indigestion, stuffy nose, feeling dizzy. So what are the more serious side effects? Priapism, chest pain, the sudden decrease or loss of vision, hearing loss, seizures, a skin reaction. So these are not all the side effects of sildenafil. For a full list, see the leaflet inside your medicines packet. So one of the commonly asked questions in my clinic is, why hasn't it worked? If sildenafil does not work for you, it may be because you have not waited long enough after taking it before trying to have sex. Or you may have waited too long after taking it to have sex. Or the dose is not high enough. Or you're not sexually aroused. Now do remember there are alternative medications available, so speak with your healthcare provider to discuss trying other tablets you could try that work in a similar way, such as tadalafil, avanafil, vardenafil, which I will talk about in another video, so subscribe to make sure you are notified when this is released. You could also try a medicine called alprostadil. This is a synthetic hormone that helps to stimulate blood flow to your penis. Alprostadil comes as an injection directly into your penis or as a small pellet placed inside your urethra. This is the tube that carries your pee from your bladder to the tip of your penis. And there are other treatment options for erectile dysfunction that do include a vacuum pump, psychological treatments, penile implants, or pelvic floor exercises. Another question that's frequently asked is whether women can use Viagra. So women can take sildenafil for pulmonary hypertension, but there's no good evidence that sildenafil works for women with sexual problems. However, a medication called flibanserin, and the brand name being Addy, is used to treat hypoactive sexual desire disorder in women who have not gone through the menopause. So hypoactive sexual desire disorder is a condition where a woman has a low libido or low sex drive or desire, which causes them distress. Flibanserin has been licensed for the use in the US by the FDA in 2015. However, currently it is not licensed in the UK. The next question is whether sildenafil can be used for the treatment of Alzheimer's disease. There are mounting studies that have shown that people who took sildenafil are less likely to develop Alzheimer's disease, so this reduced Alzheimer's disease risk. But the researchers did emphasize that they haven't shown sildenafil prevents or reverses Alzheimer's disease. So this is definitely an area of research to follow closely as further research and developments are made. And lastly, I am asked if sildenafil can be bought without a prescription. Now in the UK, you can now buy sildenafil from a pharmacy after a discussion with the pharmacist. They'll ask you some questions about your general health to make sure sildenafil is safe for you to take. If the pharmacist has any concerns about whether it is safe for you, they may advise you to see your doctor. You can also buy sildenafil over the internet, but be very careful if you do use this. Many websites sell fake medicines. So make sure it is from a reputable and approved source. Now, if you have enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week, and hit the notification bell if you want to get notified about new videos. And please make a comment in the comments section to tell me what you've enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos or my playlist.